Happy Sunday, everyone. Welcome to Our Issues Birmingham. Today's guest is Dr. Mark Wilson. He is the head of the Jefferson County Department of Health, also known as Chief Health Officer, or just plain old Health Officer, or just plain old Chief. Welcome, Mark. I know Mark. That's why we cut up a little bit.
Yeah, good to be here. Thanks for having me.
Tell us how you ended up here to begin with. Are you
asked
local?
me to come?
No, not this. No, he's going to start
the health
that
department.
with.
I won't give you a hard time. Yeah, so I started at the.
I will cut you with my tongue.
Okay, all right. I don't want any gotcha questions this morning.
I'm not going to do it.
Yeah, I've been at the health department now since 2011. Wasn't something I planned to do, actually. My career really started in indigent health care and a real passion for the underserved and low-income people. So I came to Birmingham in 1991 to work at Cooper Green Hospital as a brand new general internist, just out of training, and spent a little over 20 years there. And I sort of see it as an evolution that over time, I started caring for individual patients and then seeing that there are issues with the context, like the clinic context and the system that I'm seeing them in that needs improvement. So I very quickly became medical director of the clinics, did that for many, many years, and after a little break, I became chief of staff. But over time, I began to see just the larger and larger context that people's health is affected by a lot of things other than the relationship they have with their doctor and the medicines they take. It's where they live, barriers they have to care, what we call social determinants of health, things like education, transportation. Poverty is probably the biggest. And also starting to get interested in policy. I got really interested in the whole healthcare reform or insurance reform debate back in 2009, 2010. So I became on the board of health around that time. I was on the board of health, the board of directors for the health department in 2008 or so. And then when the then health officer decided to retire, a couple board members said, hey, you might want to think about that job. A couple other people put a bug in my ear. And I think it's not that I'm anybody special, except that I do really care about our community and have a real passion for the health and well-being of the people in our community. So it's a wonderful opportunity, greatest job in the world.
To make a difference.
Really be able to make a difference, not just in individual lives, but for our community as a whole.
What do you see health-wise as our primary concern today?
Yeah.
I know it vacillates.
Yeah. Anytime anybody asks me a question about that, I have a hard time answering it because we do so many things and we address so many issues. But I can tell you a few of the things that we've identified as priorities. One of them that is real near and dear to my heart and I think is very important to focus on is birth outcomes and infant mortality. Jefferson County has a higher infant mortality rate than Alabama, which is higher than most of the country, which is higher than most of the industrialized world.
Wow.
So we have a ways to go.
What do you think contributes to that?
A lot of things. Some of it are these social conditions and things that people live in. Some of it's things we don't have control over, like birth defects and things like that. But one of the very simple things that we can make a difference in is actually just the safety of the baby. And infant mortality, in case people don't know, is death before the first birthday. And the number we use is deaths per 1,000 live births. And our rate has been around 10.5.
Is that percent?
No, it's 10.5 babies per 1,000 live births.
So it's 1%.
Yeah. So, and relatively speaking, that's high. Another concern is the racial disparity. Black babies are more than twice as likely to die before their first birthday than whites. But one of the things we can do is just safety in the house. Safe sleep is a big one. A lot of our preventable infant deaths are from co-sleeping, mothers sleeping with their babies in the bed, and it's horrible to think about. But mother falls asleep, rolls over, and suffocates her baby. I just can't imagine how horrible that would be.
Yeah.
But that's what some of our deaths are. So we want all babies to be in a crib and on their back, even though that's counterintuitive for some people.
Yeah.
But we're doing several programmatic things and funding some things to help with that. Also, if we focus on moms and babies during that first year of life to really help them get off to a good start, then it helps a whole lot of other things on down the line.
Yeah, I was wondering how you get that word out to people that you're there for them in that time frame.
Yeah,
I mean,
well, we
this
come on shows like this.
Yeah,
Yeah.
this program would
Yeah.
be one of them.
Yeah, we are doing more in the area of public relations, marketing, things like that at the health department. Since I've gotten there, I've realized that we needed to change, make ourselves more visible.
Mm-hmm.
You know, in the past, the sort of mantra for health departments is if you don't see us, it's good news.
Not
You know,
necessarily.
Yeah, but your food is safe. We're not having disease outbreaks. Like if nobody notices, it means, well, everything's fine. But I've been concerned that if we don't do a good job of helping people know what we do, they won't come to us for the services that we offer.
Mm-hmm.
And also, we need friends. You know, we get government funding, so we need to continue getting that funding so we can keep doing good.
And I trust you get funding through Jefferson County as well.
Yeah, we get some funding from federal grants, you know, like Women, Infant, Children Nutrition Program, Family Planning, Disease Control from the CDC, lots of things like that. Air pollution funding from EPA. So lots of big grants like that. But about half of our funding comes from local tax dollars. It's a fraction of a cent of your sales tax, like a fifth of a cent of your sales tax, and a little bit of ad valorem tax.
Yeah. All right, hold that thought. I want to talk about something that's everybody's abuzz about these days, the M word. Don't go away. This is Our Issues Birmingham. We'll be right back. Welcome back to Our Issues Birmingham. I'm Tommy Spina. We're talking with Jefferson County Department of Health head, Dr. Mark Wilson. And I had mentioned something about the M word. I've kept you in suspense long enough, but measles, they're back. Or they never went away.
Well, no, they did. I mean, in 2000, measles was declared eradicated in the United States for a brief period of time.
What year?
2000. And it's a shame that we're talking about it today, frankly. We shouldn't be.
And do you think that's because there's this culture of let's not vaccinate?
Exactly. And a lot of misinformation about vaccinations.
Because vaccinations are not good anymore. I mean, I don't understand how we got there. That's a segment of our population that has taken on that philosophy.
Yeah, well, we have social media and everything where a lot of misinformation can fly around, and people want to believe conspiracy theories and other things, and so we can even say something is not true, and we've been saying it for years, about vaccines do this or that, but those that misinformation stays alive for a long time. But if we keep the population adequately vaccinated, we will not have measles outbreaks. The reason we're having measles while we're talking about it today is because people have failed to get vaccinated. And we're mainly talking about vaccinating your children. Yeah. So in Alabama, we're doing relatively well compared to some places in California and New York where they've had major outbreaks. But it could be a little better. It could be a little better in Alabama. We're still a little bit vulnerable for an outbreak.
Do you think those other factors that you mentioned in our first segment contributes to the lack of vaccination to the child because the parents are not having access to the medical care they need to get, or
not as much as you would think.
They just
we actually have good programs. I mean, our health department does a lot of vaccinations. We have pediatric clinics where we have a very large volume of low-income patients, mostly covered by Medicaid. Some are uninsured. There's also a Vaccines for Children program, a federal program that was put in place back in the 1990s that addressed that issue, making sure that all children can get vaccinated, whether they have money or not. So the irony of this is that some of the people that are choosing to not be vaccinated are actually people who are more well off, who are educated to some extent, but aren't really subscribing to what the CDC and others are recommending.
Because
So
they're
there's
smarter?
they
They
think
think
they're
they're
smarter.
smart.
There you go.
Yeah.
Yeah, and
That the
yeah,
body itself will take care of
yeah.
its own immune system?
Yeah, various ideas out there, and I don't even want to repeat some of the ideas that are out there because I
You
don't
don't
want
want
to
to
give credence
disseminate.
to it. That's
Yeah.
right. That's exactly right. Our message is get vaccinated. Vaccines are safe. They're effective. Um, and measles kills people.
Really?
And, I don't want to sensationalize things, but about 1 or 2 deaths per 1,000 measles cases. A large percentage, around 20% of people with measles have complications, including pneumonia and encephalitis, which is inflammation of the brain, hearing loss. Somebody was just telling me a story the other day. He was born in the early 1950s, had the measles, as most people did then. He got the measles in 2nd grade and remembers just being sick as a dog, sickest he's ever been in his life. He remembers a classmate of his getting measles who ended up leaving school because he lost his hearing and had to go to the school for the deaf and blind.
Wow.
Just an anecdote. But
Back in
I
the
think part of the problem is people don't remember. We don't have people that remember the 1940s, 50s when children were dying of measles.
Yeah. Well, that's my age group, but I honestly don't remember whether I've had them or not. But I know
Yeah.
I've been
Well,
vaccinated.
people who were born before 1957 are presumed to have had the measles or been exposed to it. So
that
they're
would be
not,
me.
they don't need to be vaccinated. Yeah. So,
But nowadays, so
yeah.
aside from measles, what other?
Well, if you want to talk about diseases, one thing we're concerned about is hepatitis A. It's just a new thing that just creeped across the border from Tennessee.
And to distinguish it from the one that people have heard of before, hepatitis C,
Which I'm also very concerned about.
is there a B?
Yes, hepatitis B. Yeah, A, B, and C, and then there's a couple other rarer versions that aren't worth mentioning right now. But
Tell me about A.
But A is just a more recent thing. A is a milder form of hepatitis compared to B. Usually self-limited disease, but it can make you sick, and it infrequently can kill people. But it's related somewhat to the opioid epidemic, and Kentucky and Tennessee have been hit really hard. And so we've had a few northern counties along the border that have had an outbreak, and we've had 2 cases in Jefferson County just last month.
So as it relates to the opioid epidemic, it must be from needle usage?
It can be transmitted by needle usage. It's partly drug paraphernalia being used and shared, things, needles and other things. There's also an association with homelessness, certain sexual activity, being in prison, just poor sanitary conditions.
What are those symptoms?
Well, it's an inflammation of the liver, so people get abdominal pain, they get nausea, vomiting, fever, just feeling really awful.
And it's creeping in from Tennessee, you think?
We're going to blame them for it, yeah.
Well, for now.
Yeah, but yeah, there has been a widespread epidemic in Appalachia.
Wow.
And we're working in Jefferson County to help prevent it, as much as we can. So we have a whole team of people working on a plan to encourage people to get vaccinated if they can, and if there are people such as homeless people who don't have access to vaccines, we may get out there and start vaccinating them ourselves.
Hold that thought. We'll be right back.
All right.
Okay, we're going to take a short break. We'll be right back. This is Our Issues Birmingham. Don't go away. Welcome back to Our Issues Birmingham. We're talking about, before break, about the opioid epidemic, which, I may offend some people with this, but I blame, not totally, but Big Pharma for a large part of that problem in disseminating bad information to the doctors who then overprescribed, and now all of that's changing and moving back the other way. So we tightened up the ability to get the opioids, which then opened up heroin, because you could get it on the street and it was cheaper. It's nauseating to think
Yeah.
Especially when you see the numbers that they post as revenue. Big
Right.
pharma, I'm
Yeah.
talking about.
Yeah. Certainly a major contributor. I think as a community, we need to be prepared and realize that addiction is always going to be a problem. Opioids are the thing now. Before that it was methamphetamine, cocaine. Methamphetamine
Crack?
and cocaine are coming back. Um,
I
so one
hadn't
good thing
noticed
that's
that.
happening out of all this is that we are paying more attention to addiction more generally and building infrastructure around it. Not enough infrastructure, but also just changing the conversation. I think we're starting to make more progress now to recognize that addiction is a disease. And we're working towards destigmatizing it more, and I think we're making a little progress.
Which goes hand in hand with mental health
Right.
issues as well.
Sure, that's right.
Which is also being destigmatized.
That's right. I mean, the simple way I like to look at it is your head is connected to your body, right? It's like we shouldn't treat the brain any differently. So these are diseases of the brain, whether it's depression, anxiety disorder, schizophrenia, or a substance use disorder. So we need to start integrating our thinking about health.
But we're way behind in the study of the brain. I believe. Am I correct in saying that medically? Because you can't study it because people are using it.
Yeah.
And you can't open it up and look in there and say, hey, look
although
at that.
we're getting better and better technology, like MRI scans while people are doing certain things and mapping the brain, and some very interesting things going on that are beyond my pay grade. But yeah, we've done a lot at the health department and worked a lot with partners to address the opioid crisis, and been able to do some great things in Jefferson County. And the health department, we do a lot of partnering work with others. We realize we can't do it all ourselves. We're a governmental agency, and sometimes the bureaucracy sort of moves slowly. So we do partnership work. We actually do some granting into the community to help accomplish things that we can't do ourselves. So we've had a collaboration together with others to sort of address the opioid epidemic at multiple levels.
As a criminal defense lawyer, I see a shift in who gets charged with the responsibility of the dispensing of the opioid. There was a time if a doctor wrote a script and a pharmacist saw the script, the pharmacist will fill the script, no questions asked. Now there seems to be more responsibility being put on the pharmacy to pay attention to who's refilling what and how often.
Right.
The doctors are writing scripts not for 30 or 60 or 90 pills, but for 5 or 10 pills.
We're seeing some progress.
So that's all part of what I think you were just. We're all becoming more aware and all trying to attack it from different angles.
There's the physician prescription drug monitoring program, which physicians and pharmacists can go look at.
Well, I think they expect them to go look at it now.
Yeah, the Board of Medical Examiners is requiring, at least for high-level prescribing, that physicians check, and they're watching to make sure they are. There's policies coming, and the CDC has made recommendations. Pharmacies are starting to have policies, like Walmart says, first-time prescription, we're not going to fill more than a certain amount. So we are seeing prescribing of opioids go down in Alabama. We are still number one in the nation in opioid prescriptions.
Really?
But we're going down, and everybody else is going down, so it's sort of hard to get out of that number one position. In the meantime, we've had a lot of people become addicted to heroin. And some of them are people that were going to a quote-unquote pill mill. Pill mill gets shut down by law enforcement. They have nowhere to turn. They're still addicted.
Yeah, because
so they go
it's
to
in
the
the brain.
street. Yeah, and so they go to the street, use heroin, which has no label on it, right? It doesn't say how much it is or how strong it is or what else is in it. And we're seeing a lot of deaths. So good news is just this past year, 2018, we, for the first time since this whole crisis started, saw a decrease in overdose deaths in Jefferson County. I can't say that's a trend, but I hope it is, because we've been doing a lot of work, and we've been getting some federal grant money coming in the community too to help address that.
Yeah, and there are some. I'm gonna pat Big Pharma on the back for coming up with things like Vivitrol. I'm not a big fan of things like methadone or Suboxone, because I think it just creates another addiction.
Well, let me address that real quickly. Those medicines, methadone, Suboxone, they have gotten a bad reputation, sometimes for good reason, but they keep people alive and they help people transition from using really dangerous drugs to safer drugs. And eventually, many of them do get off. So it's a good tool, it's an important tool. Abstinence-only treatment for opioid epidemic is dangerous business. We're seeing a lot of people relapse and die.
In a hurry.
Yep.
Like
Yep.
one use can
Well,
kill
you can come out of an abstinence-only program, you've been clean for 30 days or whatever, you go back out, you relapse, you take heroin again, you're not used to it, and that first dose kills you.
And then the fentanyl
The fentanyl
piece of it is also
Right.
a problem.
Yep.
Well, we're running out of time, but we've got a lot more to talk about.
We do.
And I'm going to encourage you to come back.
I'd be happy
and
to.
let's make another run at getting some information out to people about what's going on with
I've
our
only
department.
touched on a fraction of what we do and what we're working on.
Well, we appreciate you coming.
Yeah, my pleasure.
This is Our Issues Birmingham. Thanks for being with us. We'll see you next week.